Low-income Singaporeans with chronic diseases stand to benefit most from changes in health policy. An outpatient with chronic diseases such as diabetes, hypertension and high cholesterol will now be able to dig deeper into his Medisave account. The annual limit of $300 now will be increased to $400. Meanwhile, chronic disease sufferers who are 40 and older and earn between $900 to $1,500 will also benefit under the revised Primary Care Partnership Scheme. He will receive a $50 subsidy each time he visits a general practitioner. The qualifying age for the scheme has been lowered from 65 to 40, and income criteria for qualifying will be raised from $800 to $1,500. With these changes, 710,000 outpatients are now eligible for these subsidies, and that's up from the present 87,000. These changes alone are estimated to cost $28 million, but there are just two changes announced by the Health Ministry on Monday, following the National Day rally speech by Prime Minister Lee Hsien Loong on strengthening the country's social safety net. Furthermore, a middle or low-income earner can receive further subsidies to the drugs he is taking for his chronic diseases. He can receive annual subsidies of about $100 at polyclinics, or if he suffers from a more serious condition, about $230 at specialist clinics. 8 more drugs will be added to the current list of subsidized drugs. The subsidies for some higher-cost standard drugs will also increase from 50% to 75%, in total costing government $45 million. The patient can also tap on his Medifund if he requires non-residential health care, such as day rehabilitation and home nursing. 1,000 more Singaporeans are expected to benefit from this change. Addressing a possible crunch situation, Health Minister Gan Kim Yong told reporters that his team will try to simplify the application process to encourage more GPs to take up the scheme. Through the PCPS scheme, the Health Ministry hopes to bring the cost of going to a GP and a polyclinic closer for chronic patients in the lower income group, and this may in turn lessen the workload for polyclinics.
One of the objectives of the PCPS is also to encourage the middle or lower income families to also tap on the resources of the private GPs so that we will then be able to reduce the load on the polyclinics as well as to reduce the need to build more polyclinics.
All the initiatives will be pushed out by January 2012.